Question 1. Consider a scenario where a new robotic surgical system is being introduced for a complex oncological resection. The marketing materials highlight its precision and reduced invasiveness. A surgeon is evaluating whether to adopt this technology. Which approach best reflects a responsible and ethically sound decision-making process, grounded in understanding disease processes? Option A. Rely heavily on the sales representative's demonstrations and assurances that the new system is superior to all current techniques, without independently verifying the clinical data or considering the underlying disease pathology in detail. Option B. Adopt the technology immediately to remain at the forefront of surgical innovation, believing that any new technology, regardless of specific disease understanding, will eventually prove beneficial for patients with this condition. Option C. Focus primarily on the technical specifications of the robotic system, its perceived efficiency in reducing operative time, and the positive testimonials from early adopters, assuming that technological advancement inherently leads to better disease management. Option D. Prioritize a deep understanding of the specific cancer's biology, staging, and the established evidence for various treatment modalities. Then assess how the new robotic system specifically addresses these disease characteristics and improves patient outcomes compared to existing methods. Correct answer is D. Prioritize a deep understanding of the specific cancer's biology, staging, and the established evidence for various treatment modalities. Then assess how the new robotic system specifically addresses these disease characteristics and improves patient outcomes compared to existing methods. Explanation. This scenario presents a professional challenge due to the rapid evolution of surgical technology and the inherent complexity of understanding the underlying disease processes that these technologies aim to address. Professionals must navigate the ethical imperative to provide the best possible patient care, while also ensuring they possess a thorough and current understanding of both the technology and the pathology it targets. The challenge lies in distinguishing between genuine technological advancements that improve patient outcomes and those that may be driven by market forces or hype, without a solid foundation in disease understanding. The correct approach represents best professional practice because it prioritizes a deep, evidence-based understanding of the disease process as the foundation for evaluating and adopting new surgical technologies. This aligns with the core principles of patient safety and efficacy, which are paramount in surgical practice. Regulatory frameworks, such as those governing medical devices and professional conduct, implicitly or explicitly require practitioners to act in the best interest of the patient, which necessitates a thorough understanding of the condition being treated. This approach ensures that technology is a tool to address a well-understood problem, rather than a solution in search of a problem. An incorrect approach that focuses solely on the novelty or perceived efficiency of a new surgical technology, without a commensurate understanding of the disease process it aims to treat, is professionally unacceptable. This could lead to the adoption of technologies that are not truly beneficial, may introduce unforeseen risks, or are applied inappropriately, thereby violating the ethical duty of non-maleficence and beneficence. Such an approach might also contravene regulatory guidelines that mandate evidence-based practice and the use of approved medical devices for their intended purpose. Furthermore, neglecting the disease process can lead to misdiagnosis or suboptimal treatment strategies, as the technology might not be addressing the root cause of the pathology effectively. Another incorrect approach, which involves relying solely on anecdotal evidence or the recommendations of technology vendors, fails to meet the standards of professional due diligence. This bypasses the critical evaluation of scientific literature and robust clinical data, which are essential for informed decision-making. Regulatory bodies often require adherence to evidence-based medicine, and a reliance on vendor claims without independent verification can be seen as a failure to uphold professional responsibility and may expose patients to unproven or inadequately tested interventions. The professional decision-making process for similar situations should involve a systematic evaluation. First, thoroughly understand the disease process, its pathophysiology, natural history, and current standard of care. Second, critically appraise the proposed surgical technology, its mechanism of action, evidence of efficacy and safety from peer-reviewed studies, and its specific indications. Third, compare the technology's potential benefits against its risks and costs in the context of the specific disease and patient population. Finally, consult with peers, relevant professional societies, and regulatory guidance to ensure the decision aligns with best practices and ethical obligations. Question 2. The investigation demonstrates that a new robotic-assisted system for performing coronary artery bypass grafting, CABG, has shown promising preliminary results in a controlled laboratory setting. The surgical team is eager to integrate this technology into their routine practice to potentially improve surgical precision and patient recovery times. However, concerns have been raised regarding the extensive training required for the surgical staff, the need for significant capital investment, and the potential impact on existing operating room workflows. What is the most appropriate approach for the hospital to adopt regarding the implementation of this new robotic-assisted CABG system? Option A. Conduct a phased implementation strategy, beginning with a pilot program in a controlled environment with a select group of trained surgeons, followed by comprehensive staff training, workflow integration analysis, and rigorous post-implementation outcome monitoring, all while ensuring full compliance with relevant medical device regulations and surgical practice guidelines. Option B. Proceed with implementation by purchasing the system and relying on the manufacturer's basic training materials, assuming the surgical team's existing expertise in traditional CABG techniques will be sufficient to adapt quickly. Option C. Defer implementation indefinitely until the technology is fully mature and widely adopted by other leading institutions, to minimize any potential risks associated with early adoption. Option D. Immediately procure and implement the robotic system, providing on-the-job training for the surgical team, to capitalize on the perceived benefits and stay at the forefront of surgical innovation. The correct answer is D. Immediately procure and implement the robotic system, providing on-the-job training for the surgical team, to capitalize on the perceived benefits and stay at the forefront of surgical innovation. Explanation: this scenario presents a professional challenge due to the inherent complexity of implementing advanced surgical technologies, specifically in the context of coronary artery bypass grafting, CABG. The integration of new technology requires careful consideration of patient safety, efficacy, regulatory compliance, and the existing clinical workflow. The pressure to adopt innovative solutions must be balanced against the need for robust validation and evidence-based practice. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and patient-centered implementation strategy. This involves thorough pre-implementation assessment, pilot testing, comprehensive training, and continuous monitoring. Adherence to regulatory frameworks, such as those governing medical devices and clinical practice guidelines, is paramount. This approach ensures that the technology is not only technically sound, but also clinically beneficial and safe for patients undergoing CABG. It aligns with the ethical principles of beneficence and non-maleficence, ensuring that patient well-being is the primary concern. An incorrect approach that focuses solely on the perceived technological superiority without adequate validation or training poses significant regulatory and ethical failures. This could lead to adverse patient outcomes, potentially violating regulations related to medical device safety and efficacy. Ethically, it breaches the duty of care by exposing patients to unproven risks. Another incorrect approach that neglects comprehensive staff training and competency assessment would fail to meet standards for safe surgical practice and could result in procedural errors, contravening professional conduct guidelines, and potentially leading to regulatory scrutiny. Furthermore, an approach that bypasses established protocols for technology adoption, such as failing to obtain necessary institutional review board approvals or failing to adhere to manufacturer guidelines, demonstrates a disregard for regulatory compliance and established safety procedures. Professional decision-making in such situations requires a structured approach. This involves 1. Identifying the clinical need and potential technological solution. 2. Conducting a thorough literature review and evidence assessment. 3. Evaluating the technology against established clinical guidelines and regulatory requirements. 4. Developing a detailed implementation plan including risk assessment, training, and monitoring. 5. Engaging all relevant stakeholders, including surgical teams, biomedical engineers, and regulatory affairs personnel. And 6. Establishing clear metrics for success and ongoing evaluation. Question 3. Upon reviewing the surgical schedule, a surgical technologist notices that a new, advanced robotic surgical system is listed for a procedure they are assigned to assist with. The technologist has received a brief overview of the system, but has not had hands-on training or observed its use in a live surgical setting. The surgeon, who is also new to this specific robotic system, expresses enthusiasm for its potential benefits. What is the most appropriate course of action for the surgical technologist? Option A. Attempt to familiarize themselves with the robotic system by independently reviewing online tutorials and manuals immediately before the surgery, without direct consultation with the surgeon or team. Option B. Proceed with assisting in the surgery, relying on their general knowledge of surgical equipment and observing the surgeon's lead, assuming the surgeon's familiarity with the system is sufficient. Option C. Inform the surgeon that they are not comfortable assisting with the new technology due to insufficient training and request to be reassigned to a different case. Option D. Proactively communicate with the surgeon and the surgical team to express concerns about the lack of comprehensive training and to request a detailed briefing on the robotic system's operation and safety protocols before the procedure commences. The correct answer is D. Proactively communicate with the surgeon and the surgical team to express concerns about the lack of comprehensive training and to request a detailed briefing on the robotic system's operation and safety protocols before the procedure commences. Explanation. The scenario presents a common challenge in surgical technology, balancing the rapid advancement of technology with established safety protocols and the technologist's defined scope of practice. The professional challenge lies in the technologist's responsibility to ensure patient safety and the integrity of the surgical procedure when faced with new, potentially complex equipment. Careful judgment is required to assess the readiness of the technology, the adequacy of training, and the potential impact on patient care without overstepping professional boundaries or compromising established standards. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established protocols. By seeking clarification from the surgeon and ensuring proper training and understanding of the new technology, the surgical technologist acts within their scope of practice and upholds their ethical obligation to the patient. This aligns with the core principles of surgical technology, which emphasize competence, safety, and collaboration within the surgical team. Regulatory frameworks for surgical technology, such as those governing professional conduct and patient safety, would support this proactive and collaborative approach. An incorrect approach that involves proceeding with the technology without full understanding or proper training would represent a significant regulatory and ethical failure. This could lead to patient harm, equipment malfunction, or a compromised surgical outcome, violating the fundamental duty of care. Another incorrect approach, such as refusing to assist with the new technology without a valid documented reason, e.g., lack of training, safety concerns, could be seen as insubordination or a failure to adapt to evolving surgical practices, potentially impacting team dynamics and patient care if the technology is indeed safe and beneficial. A third incorrect approach, attempting to operate the technology without adequate instruction and relying solely on observation, bypasses essential safety checks and demonstrates a lack of professional responsibility, risking both patient and personal safety. Professionals should employ a decision-making framework that begins with assessing the situation and identifying potential risks. This involves understanding the new technology, its intended use, and any associated safety concerns. Next, they should consult relevant resources, including the surgeon, manufacturer guidelines, and institutional policies. If there are any doubts or uncertainties, seeking clarification and ensuring adequate training are paramount. Collaboration with the surgical team and open communication are essential throughout this process. The ultimate goal is to ensure patient safety and contribute effectively to the surgical procedure, while operating within the established professional and regulatory guidelines. Question 4. Stakeholder feedback indicates a growing patient interest in advanced surgical technologies, such as robotic-assisted procedures, even for common general surgery operations. A patient with a condition typically managed by a standard laparoscopic approach expresses a strong desire to undergo a newly available robotic-assisted surgery, citing perceived benefits of precision and faster recovery. The surgeon is experienced in both laparoscopic and robotic techniques, but is aware that the robotic approach for this specific procedure is more expensive and has a longer learning curve for the surgical team, though initial outcomes are promising. The surgeon believes the laparoscopic approach is still the gold standard for this condition and offers comparable outcomes with fewer resource implications. What is the most ethically and professionally appropriate course of action for the surgeon? Option A. Recommend the laparoscopic approach as the established and cost-effective standard, without extensively detailing the robotic option, to guide the patient towards what the surgeon deems the most appropriate treatment. Option B. Conduct a comprehensive discussion with the patient, detailing the benefits, risks, and alternatives of both the robotic-assisted and laparoscopic procedures, ensuring the patient fully understands the implications of each, and then allow the patient to make the final decision. Option C. Decline the robotic-assisted surgery due to its higher cost and the surgeon's familiarity with the laparoscopic method, explaining that the benefits do not outweigh the drawbacks for this particular case. Option D. Proceed with the robotic-assisted surgery as requested by the patient, prioritizing their expressed preference for the newer technology. The correct answer is B. Conduct a comprehensive discussion with the patient, detailing the benefits, risks, and alternatives of both the robotic-assisted and laparoscopic procedures, ensuring the patient fully understands the implications of each, and then allow the patient to make the final decision. Explanation. This scenario presents a professional challenge due to the inherent conflict between patient autonomy and the surgeon's perceived best interest, compounded by the rapid advancement of surgical technology. The surgeon must navigate the ethical imperative to inform the patient of all relevant options, while also ensuring the patient's decision-making capacity is not compromised by undue influence or a lack of understanding. The Tech in Surgery Certified Certification Framework, as per UK regulations and CISI guidelines, emphasizes informed consent, patient-centered care, and the responsible adoption of new technologies. Correct approach, which involves a thorough discussion of the new robotic-assisted procedure, its benefits, risks, and alternatives, including the established laparoscopic method, and then allowing the patient to make the final decision, represents best professional practice. This aligns with the core principles of informed consent, which requires that patients receive sufficient information to make a voluntary and informed choice about their treatment. It respects patient autonomy, a cornerstone of medical ethics and UK healthcare law. The surgeon's role is to facilitate informed decision-making, not to dictate it. An incorrect approach that involves proceeding with the robotic surgery without a detailed discussion of the established laparoscopic alternative fails to uphold the principle of informed consent. This would be a regulatory and ethical failure, as it deprives the patient of the opportunity to weigh all available options and make a choice based on a complete understanding of the risks and benefits of each. It could also be seen as a breach of professional duty of care, as it prioritizes the surgeon's interest in using new technology over the patient's right to choose the most appropriate treatment for them. Another incorrect approach, which is to dismiss the patient's interest in the robotic surgery due to its novelty and potential for higher costs, is also professionally unacceptable. This demonstrates a lack of respect for patient preferences and could be perceived as paternalistic. While cost is a factor in healthcare, it should not be the sole determinant of treatment recommendations, especially when it overrides a patient's expressed interest and a potentially beneficial technological advancement. This approach fails to engage in a collaborative decision-making process and may violate the ethical obligation to offer the best available care. Considering patient values, the professional decision-making process in such situations should involve a structured approach. 1. Assess the patient's understanding and capacity to consent. 2. Clearly explain all available treatment options, including their respective risks, benefits, and alternatives. 3. Actively listen to and address the patient's concerns, preferences, and values. 4. Document the informed consent process thoroughly. 5. Consult with colleagues or ethics committees if there are complex ethical considerations or significant disagreements. 6. Prioritize patient well-being and autonomy in all decisions. Question 5. Examination of the data shows that a hospital has acquired a new robotic surgical system intended to enhance precision and minimally invasive capabilities. The Surgical Technology Committee is tasked with developing an implementation strategy. Which of the following approaches best aligns with regulatory requirements and best professional practice for integrating this advanced equipment into surgical services? Option A. Conduct a pilot program with a select group of experienced surgeons and surgical teams, involving thorough preclinical validation of the system's performance in simulated environments and extensive, hands-on training tailored to the institution's specific surgical procedures and protocols. followed by a phased rollout based on performance metrics and feedback. Option B. Prioritize the technical specifications and advanced features of the robotic system, proceeding with implementation once the system is physically installed and basic operational training is provided by the manufacturer. Option C. Immediately deploy the robotic surgical system for all eligible procedures, assuming the manufacturer's standard training is sufficient and relying on surgeons' general familiarity with robotic technology. Option D. Implement the robotic surgical system for routine procedures only after a comprehensive review of its technical manuals and a brief orientation session for the surgical staff, without conducting site-specific validation or a pilot phase. The correct answer is A. Conduct a pilot program with a select group of experienced surgeons and surgical teams, involving thorough preclinical validation of the system's performance in simulated environments and extensive, hands-on training, tailored to the institution's specific surgical procedures and protocols, followed by a phased rollout based on performance metrics and feedback. Explanation. Scenario analysis. This scenario presents a common implementation challenge in surgical technology, integrating new, advanced equipment into existing workflows while ensuring patient safety and regulatory compliance. The challenge lies in balancing the potential benefits of innovation with the inherent risks of unfamiliar technology, the need for adequate staff training, and the strict requirements of surgical protocols. Professionals must exercise careful judgment to avoid compromising patient care or violating established guidelines. Correct approach analysis. The correct approach prioritizes a phased, evidence-based implementation that includes rigorous validation and comprehensive training. This aligns with best professional practice by ensuring that the new robotic surgical system is not only technically functional, but also safely and effectively integrated into the surgical environment. This approach demonstrates adherence to principles of patient safety, risk management, and continuous quality improvement, which are implicitly or explicitly mandated by regulatory frameworks governing medical device implementation and surgical practice. It ensures that all potential issues are identified and addressed before widespread use, minimizing the risk of adverse events and ensuring that surgical teams are competent in operating the new technology. Incorrect approaches analysis. One incorrect approach involves immediate full-scale deployment without prior validation or comprehensive training. This represents a significant regulatory and ethical failure. It violates the principle of do no harm by exposing patients to potential risks associated with an unproven integration of technology. Ethically, it demonstrates a disregard for patient safety and a failure to adequately prepare the surgical team. From a regulatory standpoint, it likely contravenes guidelines that mandate risk assessment, validation of new medical equipment, and appropriate staff competency before its use in patient care. Another incorrect approach focuses solely on the technical specifications of the robotic system, neglecting the practical aspects of its integration into surgical workflows and the training needs of the surgical team. This is professionally unacceptable, as it overlooks the human factors and operational complexities crucial for safe and effective use. Regulatory frameworks emphasize not just the device's capabilities, but also its safe and effective application within the clinical setting. Ignoring training and workflow integration can lead to errors, delays, and compromised patient outcomes, which are direct violations of patient safety standards. A third incorrect approach involves relying solely on the manufacturer's basic training materials without conducting site-specific validation or supplementary training tailored to the institution's specific protocols and patient population. While manufacturer training is a starting point, it is often generic. Professional practice and regulatory compliance require that the implementation be validated within the actual clinical environment, and that staff receive training that addresses the unique challenges and nuances of their specific practice. Failure to do so can result in a gap between theoretical knowledge and practical application, increasing the risk of errors and compromising patient safety. Professional reasoning. Professionals should adopt a systematic, risk-based approach to implementing new surgical technologies. This involves a thorough needs assessment, careful selection of equipment, rigorous validation and testing, comprehensive and ongoing training for all relevant personnel, and continuous monitoring of performance and patient outcomes. Decision-making should be guided by established clinical guidelines, regulatory requirements, ethical principles of patient welfare, and a commitment to evidence-based practice. A culture of safety and open communication is essential to identify and address potential issues proactively. Question 6. Performance analysis shows that a surgeon is preparing for a complex abdominal procedure where preoperative imaging has indicated a potential for significant anatomical variation in the vascular supply to a critical organ. Which of the following represents the most appropriate approach to ensure optimal patient safety and surgical outcome? Option A. Proceed with the planned surgical approach, assuming the imaging findings are within acceptable limits of variation and can be managed intraoperatively as encountered. Option B. Postpone the surgery until further, more detailed imaging can be obtained to definitively rule out any anatomical variations, even if it delays necessary treatment. Option C. Conduct a thorough preoperative review of all imaging studies, specifically looking for and documenting any deviations from standard anatomy, and develop contingency plans for potential intraoperative findings. Option D. Rely solely on the preoperative imaging report without further personal review, trusting the radiologist's interpretation and proceeding with the standard surgical technique. The correct answer is A. Proceed with the planned surgical approach, assuming the imaging findings are within acceptable limits of variation and can be managed intraoperatively as encountered. Explanation. Scenario analysis. This scenario presents a challenge in surgical decision-making, where a surgeon must balance the immediate need for intervention with a thorough understanding of the patient's underlying anatomical variations. The complexity arises from the potential for unexpected anatomical findings during surgery, which can significantly impact the surgical plan, operative time, and patient outcomes. A failure to anticipate or adequately assess these variations can lead to complications, increased morbidity, and potential legal ramifications. The professional challenge lies in integrating preoperative imaging, intraoperative findings, and anatomical knowledge to ensure patient safety and optimal surgical execution. Correct approach analysis. The correct approach involves a meticulous preoperative review of imaging studies, specifically focusing on identifying any deviations from standard anatomy. This includes a detailed assessment of the vascular supply, nerve pathways, and organ relationships relevant to the planned procedure. During surgery, the surgeon must maintain a high index of suspicion for anatomical variations and be prepared to adapt the surgical technique accordingly. This proactive and adaptable approach aligns with best practices in surgical care, emphasizing patient safety and minimizing iatrogenic injury. It is ethically mandated to provide care that is informed by the best available knowledge and tailored to the individual patient's anatomy. Regulatory frameworks, such as those governing medical practice and patient safety, implicitly require surgeons to exercise due diligence in understanding and managing anatomical complexities. Incorrect approach is analysis. One incorrect approach is to proceed with surgery assuming standard anatomy without a thorough preoperative review of imaging, especially in cases where variations are known to be common for the specific procedure or patient demographic. This demonstrates a failure to adhere to the principle of informed consent and due diligence, potentially violating ethical obligations to provide competent care. Regulatory bodies would view this as a breach of professional standards, as it increases the risk of preventable surgical errors. Another incorrect approach is to ignore or dismiss intraoperative findings that suggest anatomical variation, attempting to force the procedure into the preoperative plan. This is a direct contravention of the surgeon's duty to adapt to the operative field and prioritize patient safety. Ethically, it represents a failure to act in the patient's best interest. From a regulatory perspective, this could be considered gross negligence, as it demonstrates a disregard for critical intraoperative information that directly impacts patient well-being. A third incorrect approach is to rely solely on preoperative imaging without considering the possibility of intraoperative discrepancies or the limitations of imaging technology. While imaging is crucial, it is not infallible. Failure to maintain vigilance and adapt based on direct visualization during surgery can lead to significant complications. This approach fails to meet the standard of care expected of a competent surgeon, which includes integrating all available information, both preoperative and intraoperative, to guide surgical decisions. Professional reasoning. Professionals should adopt a systematic approach that begins with comprehensive preoperative assessment, including a critical review of all diagnostic imaging for potential anatomical variations. This should be followed by intraoperative vigilance, where the surgical field is continuously assessed for any deviations from expected anatomy. If variations are encountered, the surgeon must be prepared to modify the surgical plan, consult with colleagues if necessary, and prioritize patient safety above all else. This decision-making process is guided by the ethical principles of beneficence, non-maleficence, and professional competence, and is supported by regulatory requirements for safe and effective medical practice. Question 7. Process analysis reveals a surgeon has recently acquired a cutting-edge arthroscopic system that offers enhanced visualization and novel instrumentation. While the manufacturer touts significant improvements, peer-reviewed literature on its long-term efficacy and patient outcomes compared to established arthroscopic techniques for a specific common knee pathology is still emerging. The surgeon is aware that utilizing the new system may lead to higher billing codes. The patient presents with this common knee pathology and is seeking treatment. What is the most ethically and professionally sound approach for the surgeon? Option A. Immediately utilize the new arthroscopic system, emphasizing its advanced features and potential for quicker recovery, as it represents the latest advancement in surgical technology. Option B. Decline to use the new arthroscopic system and proceed with the older, familiar technique, citing a preference for proven methods and a lack of enthusiasm for adopting new technologies without extensive personal experience. Option C. Recommend the established, evidence-based arthroscopic technique for the patient's condition, while also informing them about the newer technology, its potential benefits, and the current limitations in long-term outcome data, allowing for a shared decision-making process. Option D. Proceed with the new arthroscopic system, assuming its advanced nature implies superior outcomes, and inform the patient that this is the most modern and effective treatment available. The correct answer is C. Recommend the established evidence-based arthroscopic technique for the patient's condition, while also informing them about the newer technology, its potential benefits, and the current limitations in long-term outcome data, allowing for a shared decision-making process. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between patient autonomy, the surgeon's expertise, and the potential for financial gain influencing medical decisions. The surgeon must navigate the ethical imperative to act in the patient's best interest, while also considering the availability and appropriateness of newer technologies. The pressure to adopt novel techniques, especially if they are associated with higher reimbursement or prestige, can create a subtle bias that requires conscious mitigation. Correct approach analysis. The correct approach prioritizes a thorough, evidence-based assessment of the new arthroscopic technology's efficacy and safety for the specific patient's condition. This aligns with the core ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also adheres to professional guidelines that mandate the use of established, proven treatments unless a novel approach offers a demonstrable, superior benefit supported by robust clinical data. The surgeon has a duty to inform the patient about all reasonable options, including the risks and benefits of both established and emerging technologies, allowing for shared decision-making. This approach upholds patient autonomy and ensures that treatment decisions are driven by clinical evidence and patient needs, not solely by the availability of new equipment or potential financial incentives. Incorrect approaches analysis. One incorrect approach involves immediately adopting the new arthroscopic technology solely because it is newer and potentially more advanced, without a comprehensive review of its clinical evidence base. This fails to uphold the principle of non-maleficence, as the technology may not be proven to be safe or effective for the patient's specific condition, potentially leading to suboptimal outcomes or complications. It also undermines patient autonomy by not fully informing them of the risks and benefits of established alternatives. Another incorrect approach is to dismiss the new technology outright without objective evaluation, perhaps due to personal preference or a reluctance to change established practice. This can be detrimental if the new technology genuinely offers a significant advantage for the patient. It violates the principle of beneficence by potentially withholding a superior treatment option and fails to engage in continuous professional development and the responsible adoption of beneficial innovations. A third incorrect approach is to proceed with the new technology without fully disclosing its experimental nature or the lack of extensive long-term data to the patient. This is a direct violation of informed consent principles and patient autonomy. It also breaches professional integrity by not being transparent about the evidence supporting the chosen treatment. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. This involves 1. Identifying the ethical principles at play: autonomy, beneficence, non-maleficence, justice. 2. Gathering all relevant clinical information, including peer-reviewed literature on both established and novel technologies. 3. Consulting with colleagues or seeking expert opinions if necessary. 4. Engaging in open and honest communication with the patient, presenting all viable options with their respective risks, benefits, and uncertainties. 5. Documenting the decision-making process and the rationale for the chosen treatment. This systematic approach ensures that decisions are ethically sound, clinically justified, and patient-centered. Question 8. Analysis of a surgeon's decision-making process when considering the use of a novel, unapproved robotic surgical system for performing an appendectomy, where the system has demonstrated promising preliminary results in laboratory settings, but has not yet received full regulatory clearance for widespread clinical use in this specific procedure. Option A. Seek Institutional Review Board (IRB) approval and follow the Investigational Device Exemption (IDE) pathway if applicable, ensuring all regulatory requirements are met before considering patient use. Option B. Proceed with the use of the robotic system based on the manufacturer's claims and the surgeon's personal belief in its superiority, without seeking further ethical or regulatory review. Option C. Implement the robotic system for appendectomies immediately, prioritizing patient access to potentially advanced technology over formal regulatory and ethical oversight, assuming the risks are minimal. Option D. Utilize the unapproved robotic system for appendectomies, justifying its use with anecdotal evidence from colleagues who have used similar unproven technologies, and without a formal plan for data collection. The correct answer is A. Seek Institutional Review Board (IRB) approval and follow the Investigational Device Exemption (IDE) pathway if applicable, ensuring all regulatory requirements are met before considering patient use. Explanation. Scenario analysis. This scenario presents a common challenge in surgical practice where a novel technological advancement, while promising, has not yet undergone extensive real-world validation or regulatory approval for widespread clinical adoption in the specific context of appendectomy. The surgeon must balance the potential benefits of innovation with the paramount duty of patient safety and adherence to established medical standards and regulatory frameworks. The pressure to adopt new technologies, coupled with the desire to provide cutting-edge care, can create a conflict that requires careful ethical and professional deliberation. Correct approach analysis. The correct approach prioritizes patient safety and regulatory compliance by seeking explicit Institutional Review Board (IRB) approval and adhering to the established Investigational Device Exemption (IDE) pathway if the technology is considered experimental. This aligns with the fundamental ethical principle of beneficence and non-maleficence, ensuring that any deviation from standard practice is rigorously evaluated for safety and efficacy. Regulatory frameworks, such as those governing medical devices and clinical trials, are designed to protect patients from unproven or potentially harmful interventions. Seeking IRB approval and following IDE guidelines demonstrates a commitment to evidence-based medicine and responsible innovation, ensuring that the technology's use is monitored, data is collected appropriately, and patient welfare remains the primary concern. This approach upholds the surgeon's professional responsibility to act in the best interest of the patient, while respecting the regulatory oversight designed to maintain high standards of care. Incorrect approaches analysis. One incorrect approach involves proceeding with the use of the unapproved robotic system without any formal ethical or regulatory review. This represents a significant ethical failure by disregarding the principle of patient autonomy and informed consent, as patients would not be aware they are participating in an unapproved experimental procedure. It also constitutes a direct violation of regulatory requirements for investigational medical devices, potentially exposing the surgeon and institution to legal and professional sanctions. Another incorrect approach is to rely solely on the manufacturer's assurances of the technology's efficacy and safety, without independent institutional or regulatory validation. While manufacturer data is important, it is not a substitute for the rigorous, independent scrutiny required by ethical review boards and regulatory bodies. This approach risks overlooking potential risks or limitations not fully disclosed by the manufacturer, and fails to meet the professional standard of due diligence in adopting new medical technologies. It bypasses the critical oversight mechanisms designed to protect the public. A third incorrect approach is to justify the use of the unapproved technology based on anecdotal evidence or the perceived cutting-edge nature of the intervention, without a structured plan for data collection or outcome assessment. This prioritizes novelty over evidence and patient safety. It fails to contribute to the scientific understanding of the technology's effectiveness and risks exposing patients to potential harm, without a clear benefit or a mechanism for learning from the experience. This approach undermines the principles of evidence-based practice and responsible medical advancement. Professional reasoning. Professionals facing such a decision should employ a structured decision-making framework that begins with a thorough understanding of the patient's condition and the standard of care. They must then critically evaluate any proposed novel technology, assessing its evidence base, potential risks and benefits, and regulatory status. The framework should include consulting institutional policies, seeking guidance from ethics committees and regulatory affairs departments, and ensuring full transparency with the patient regarding the experimental nature of any intervention. This systematic approach ensures that decisions are grounded in patient welfare, ethical principles, and regulatory compliance, fostering a culture of responsible innovation and patient protection. Question 9. Governance review demonstrates that a surgical department is considering the adoption of a novel robotic surgical system. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for introducing new surgical technologies? Option A. Prioritize the acquisition of the technology based on its potential to reduce operational costs, deferring detailed validation and staff training until after initial implementation. Option B. Adopt the system after a brief demonstration and a general assurance from the manufacturer that it is safe for clinical use. Option C. Proceed with adoption after confirming the technology has received all necessary regulatory approvals and that surgical staff have undergone comprehensive, documented training specific to its operation. Option D. Implement the technology immediately based on its innovative features and the positive feedback received from a single, unverified source in another hospital. Correct answer is C. Proceed with adoption after confirming the technology has received all necessary regulatory approvals and that surgical staff have undergone comprehensive, documented training specific to its operation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent risks associated with the rapid adoption of new surgical technologies. The pressure to innovate and offer cutting-edge treatments can sometimes outpace the thorough evaluation of safety, efficacy, and regulatory compliance. Professionals must balance the potential benefits of new technologies with the imperative to protect patient well-being and adhere to established standards. This requires a nuanced understanding of the regulatory landscape and a commitment to rigorous due diligence. Correct approach analysis. The correct approach, which involves a comprehensive review of the technology's validation, regulatory approvals, and the training of surgical staff, represents best professional practice because it directly addresses the core tenets of patient safety and regulatory compliance. Specifically, it aligns with the principles of responsible innovation and the ethical obligation to ensure that any technology introduced into surgical practice has undergone appropriate scrutiny. This approach prioritizes patient welfare by confirming that the technology is not only effective, but also safe, and that the individuals using it are adequately prepared. It demonstrates adherence to the spirit and letter of regulatory frameworks that mandate pre-market approval, post-market surveillance, and ongoing professional development. Incorrect approaches analysis. Implementing a new surgical technology solely based on its perceived novelty or the enthusiasm of its developers, without independent validation and regulatory clearance, constitutes a significant regulatory and ethical failure. This approach bypasses essential safety checks and could expose patients to unproven risks. It violates the principle of evidence-based practice and disregards the regulatory requirement for technologies to meet established standards of safety and efficacy before clinical use. Adopting a technology based on anecdotal evidence or testimonials from other institutions, without verifying specific regulatory approvals or conducting an independent risk-benefit analysis, is also professionally unacceptable. This method relies on hearsay rather than verifiable data and regulatory endorsement, potentially leading to the adoption of technologies that have not met the stringent requirements for patient safety. It represents a failure to exercise due diligence and a disregard for the systematic processes designed to protect patients. Focusing exclusively on the cost-effectiveness of a new surgical technology while neglecting its validation, regulatory status, and staff training is a critical oversight. While cost is a factor in healthcare decisions, it must never supersede patient safety and regulatory compliance. Prioritizing financial considerations over the fundamental requirements for safe and effective patient care is a direct violation of ethical obligations and regulatory mandates. Professional reasoning. Professionals facing decisions about adopting new surgical technologies should employ a structured decision-making process. This process begins with identifying the clinical need and potential benefits of the technology. Subsequently, a thorough investigation into the technology's regulatory status, including any required approvals or certifications, is paramount. This must be followed by an independent assessment of its safety and efficacy, supported by robust scientific evidence. Concurrently, a comprehensive evaluation of the training and competency requirements for the surgical team is essential. Finally, a formal risk-benefit analysis, considering patient outcomes, ethical implications, and resource allocation, should guide the ultimate decision. This systematic approach ensures that patient safety and regulatory compliance remain at the forefront of all technological advancements in surgery. Question 10. The evaluation methodology shows that a new stereotactic surgery system offers potential for improved precision and reduced invasiveness. However, the initial assessment indicates variability in performance metrics compared to existing methods, and the vendor has provided limited long-term outcome data. Which approach best ensures responsible integration of this technology into surgical practice? Option A. Conduct a phased implementation, starting with a pilot program in a controlled environment with rigorous data collection and comparative analysis against current standards, alongside comprehensive staff training and competency validation. Option B. Implement the new system immediately for all eligible procedures, relying on vendor assurances and the potential for future data collection to address any emerging issues. Option C. Utilize the new system only for complex cases where existing methods are demonstrably insufficient, without formal comparative evaluation or dedicated training, assuming experienced surgeons can adapt quickly. Option D. Delay adoption indefinitely until the vendor can provide extensive, peer-reviewed, long-term outcome data that definitively proves superiority over all existing techniques. The correct answer is B. Implement the new system immediately for all eligible procedures, relying on vendor assurances and the potential for future data collection to address any emerging issues. Explanation. This scenario presents a professional challenge in ensuring the safe and effective integration of advanced stereotactic surgery technology within a clinical setting. The core difficulty lies in balancing the potential benefits of novel technology with the imperative to maintain patient safety, adhere to established clinical protocols, and comply with regulatory requirements for medical devices and surgical procedures. Careful judgment is required to navigate the complexities of technology validation, staff training, and ongoing performance monitoring. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based evaluation of the stereotactic surgery system's performance and safety profile. This aligns with regulatory frameworks that mandate rigorous validation of medical technologies before widespread clinical adoption. Specifically, it emphasizes objective data collection, comparison against established benchmarks, and a thorough assessment of potential risks and benefits. This methodical process ensures that the technology is not only technically sound, but also clinically appropriate and safe for patient use, thereby upholding the ethical obligation to provide competent and responsible care. Adherence to guidelines for medical device evaluation and surgical innovation is paramount. An incorrect approach that focuses solely on the perceived efficiency gains without comprehensive validation would represent a significant regulatory and ethical failure. This could lead to the deployment of a system that has not been adequately tested for accuracy, reliability, or potential adverse events, thereby jeopardizing patient safety. Such an approach would violate regulations governing medical device approval and use, which require demonstrable efficacy and safety. Another incorrect approach that bypasses thorough staff training and competency assessment before utilizing the technology would also be a critical failure. This neglects the ethical duty to ensure that all personnel involved in patient care are adequately skilled and knowledgeable, increasing the risk of procedural errors and patient harm. Furthermore, it contravenes guidelines on professional development and the safe operation of complex medical equipment. Professionals should employ a decision-making framework that begins with a clear understanding of the regulatory landscape governing medical technology and surgical procedures. This involves identifying all applicable laws, guidelines, and institutional policies. The next step is to conduct a comprehensive risk-benefit analysis, considering both the potential advantages and disadvantages of adopting the new technology. This analysis should be informed by objective data and expert opinion. Subsequently, a robust validation and training plan must be developed and executed, ensuring that the technology is thoroughly tested and that all personnel are adequately prepared. Finally, continuous monitoring and evaluation of the technology's performance and patient outcomes are essential for ongoing quality improvement and regulatory compliance. Question 11. Research into the effectiveness of a new automated instrument washer disinfector in a busy surgical suite has revealed a potential for residual organic matter on complex surgical instruments if the pre-cleaning cycle is not meticulously followed. Considering the regulatory framework for surgical technology in the UK, which of the following approaches best mitigates the risk of patient infection arising from inadequate sterilization? Option A. Conducting a risk assessment that focuses only on the potential for instrument damage during the washing process, as this is the primary concern highlighted in the initial research. Option B. Relying solely on the manufacturer's recommended pre-cleaning and sterilization cycle times, assuming the automated system guarantees sterility. Option C. Implementing a mandatory, documented visual inspection of all instruments by a trained technician immediately after the washer disinfector cycle, coupled with a periodic audit of the washer disinfector's performance logs and a review of the pre-cleaning protocol adherence by surgical staff. Option D. Delegating the responsibility for ensuring adequate pre-cleaning to the most junior member of the surgical team, with the expectation that they will learn through experience. The correct answer is C. Implementing a mandatory, documented visual inspection of all instruments by a trained technician immediately after the washer disinfector cycle, coupled with a periodic audit of the washer disinfector's performance logs and a review of the pre-cleaning protocol adherence by surgical staff. Explanation. This scenario presents a professional challenge due to the critical nature of sterilization and infection control in surgical technology. A lapse in these protocols can lead to severe patient harm, including surgical site infections, prolonged recovery, and even mortality. The challenge lies in balancing the need for efficient workflow with the absolute imperative of patient safety, requiring meticulous attention to detail and adherence to established guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted risk assessment that directly addresses the potential failure points in the sterilization process. This aligns with the fundamental principles of patient safety and regulatory compliance, ensuring that all critical steps are validated and monitored. Specifically, it reflects the proactive stance mandated by infection control guidelines, which emphasize identifying and mitigating risks before they manifest as patient harm. This approach demonstrates a commitment to continuous improvement and a thorough understanding of the technological and procedural aspects of sterilization. An incorrect approach that focuses solely on visual inspection of instruments is professionally unacceptable. This fails to account for microscopic contaminants or the effectiveness of the sterilization cycle itself, which cannot be reliably assessed by sight alone. This approach violates regulatory requirements for validated sterilization processes and ethical obligations to ensure patient safety. Another incorrect approach that relies on the manufacturer's stated sterilization time without internal validation is also professionally deficient. While manufacturer instructions are important, they do not absolve the surgical team from ensuring the equipment and processes within their specific environment are functioning correctly and achieving the desired level of sterility. This oversight can lead to understerilization and increased infection risk, contravening established protocols and ethical duties. A further incorrect approach that delegates the entire responsibility for sterilization validation to a single individual without a robust oversight or verification system is problematic. While delegation is necessary, ultimate accountability for patient safety rests with the entire surgical team. This approach risks creating a single point of failure and may not ensure consistent adherence to best practices or regulatory standards. The professional decision-making process for similar situations should involve a systematic risk assessment framework. This begins with identifying potential hazards in the sterilization process, e.g., equipment malfunction, human error, inadequate cleaning. Next, the likelihood and severity of harm associated with each hazard are evaluated. Based on this assessment, control measures are implemented, such as using validated sterilization cycles, regular equipment maintenance, comprehensive staff training, and robust monitoring systems. Finally, the effectiveness of these control measures is continuously evaluated and adjusted as needed. This iterative process ensures that patient safety remains paramount and that all actions are grounded in evidence-based practice and regulatory compliance. Question 12. Strategic planning requires a comprehensive approach to integrating new technologies into surgical procedures. When considering the adoption of an advanced robotic system for laparoscopic cholecystectomy, what is the most critical regulatory compliance consideration to ensure patient safety and adherence to established medical device guidelines? Option A. Obtaining independent validation of the robotic system's performance metrics and ensuring it meets all applicable regulatory body approvals for medical devices used in minimally invasive surgery. Option B. Implementing the robotic system immediately to gain a competitive advantage in surgical innovation. Option C. Focusing on the system's user interface intuitiveness for the surgical team without verifying its underlying safety and efficacy certifications. Option D. Prioritizing the cost-effectiveness of the robotic system and its potential to reduce operating room turnover times. The correct answer is A. Obtaining independent validation of the robotic system's performance metrics and ensuring it meets all applicable regulatory body approvals for medical devices used in minimally invasive surgery. Explanation. This scenario presents a professional challenge due to the inherent risks associated with surgical technology implementation, particularly in a sensitive area like cholecystectomy. Ensuring patient safety, data integrity, and compliance with evolving regulatory landscapes requires meticulous planning and adherence to established frameworks. The challenge lies in balancing technological advancement with the stringent requirements of healthcare regulation. The correct approach represents best professional practice because it prioritizes a comprehensive risk assessment and validation process aligned with the regulatory framework for medical devices and surgical technologies. This includes ensuring that any new technology or its application in cholecystectomy has undergone rigorous testing, validation, and received appropriate regulatory approval e.g., FDA clearance or CE marking, depending on the jurisdiction specified for the exam. It also necessitates robust training for surgical teams and clear protocols for data management and cybersecurity, all of which are mandated or strongly guided by healthcare regulations. This proactive and compliant approach minimizes potential harm to patients and ensures the ethical and legal use of technology. An incorrect approach that involves deploying a new robotic-assisted cholecystectomy system without prior independent validation of its performance metrics against established benchmarks fails to meet regulatory requirements for device efficacy and safety. This bypasses critical steps designed to protect patients and could lead to adverse outcomes. Another incorrect approach, focusing solely on cost-effectiveness without a thorough assessment of the technology's impact on surgical outcomes and patient safety, disregards the primary regulatory mandate of patient well-being. Furthermore, implementing a new technology without adequate training for the surgical team violates guidelines for safe medical practice and could result in procedural errors, directly contravening regulatory expectations for competent healthcare delivery. Professionals should employ a decision-making framework that begins with identifying the specific regulatory jurisdiction and its relevant guidelines for surgical technology. This involves a thorough understanding of pre-market approval processes, post-market surveillance requirements, data privacy regulations, like HIPAA in the U.S., if applicable, and professional standards of care. The framework should then involve a systematic evaluation of any proposed technological intervention against these requirements, prioritizing patient safety, clinical efficacy, and ethical considerations. A multidisciplinary team, including clinicians, IT specialists, and regulatory affairs personnel, should be involved in the assessment and decision-making process. Question 13. Governance review demonstrates that the cardiothoracic surgery department is considering the adoption of a new robotic surgical system to enhance precision in complex procedures. However, the review also highlights a lack of formal protocols for evaluating and integrating novel surgical technologies. What is the most appropriate course of action for the department to ensure patient safety and regulatory compliance while exploring this innovation? Option A. Proceed with a limited trial of the robotic system on a small patient cohort without formal training or risk assessment to gather preliminary data on its usability. Option B. Conduct a thorough, independent risk assessment of the robotic system. Develop a comprehensive training and credentialing program for the surgical team and establish clear performance monitoring metrics before full adoption. Option C. Immediately implement the new robotic system, relying on the manufacturer's training materials and assuming its efficacy based on industry trends. Option D. Postpone any consideration of the robotic system until a dedicated research team can be formed to study its theoretical benefits without engaging the clinical team in the evaluation process. Correct answer is C. Immediately implement the new robotic system, relying on the manufacturer's training materials and assuming its efficacy based on industry trends. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent risks associated with advanced cardiothoracic surgical procedures and the rapid integration of new technologies. The pressure to adopt innovative solutions for improved patient outcomes must be balanced against rigorous safety protocols, regulatory compliance, and the need for comprehensive training. The governance review highlights a potential gap in oversight, requiring a proactive and systematic response to ensure patient safety and adherence to established standards. Correct approach analysis. The correct approach emphasizes a multifaceted strategy that prioritizes patient safety and regulatory adherence. This involves a thorough risk assessment of the new robotic system, validation of its performance against established benchmarks, and the development of a comprehensive training program for the surgical team. This approach aligns with the core principles of medical device regulation and surgical best practices, ensuring that any new technology is implemented safely and effectively. Specifically, it addresses the need for evidence-based decision-making, robust quality assurance, and continuous professional development, all of which are critical for maintaining high standards in cardiothoracic surgery. This systematic evaluation and preparation process is mandated by regulatory frameworks that govern the introduction of new medical technologies into clinical practice, ensuring that patient well-being remains paramount. Incorrect approaches analysis. One incorrect approach would be to immediately adopt the new robotic system without adequate validation or training. This represents a significant regulatory and ethical failure. It bypasses essential safety checks and could lead to adverse patient events due to unfamiliarity with the technology or unforeseen technical issues. This approach disregards the principles of due diligence and risk management, which are fundamental to patient care and regulatory compliance. Another incorrect approach would be to delay adoption indefinitely due to perceived complexity, without exploring potential solutions for training and validation. While caution is important, an outright refusal to consider beneficial technological advancements without a thorough, evidence-based rationale can be seen as a failure to provide patients with the best available care, potentially contravening ethical obligations to advance medical practice. This approach might also fall short of regulatory expectations for healthcare institutions to remain current with evidence-based innovations. A third incorrect approach would be to rely solely on the manufacturer's assurances regarding the system's safety and efficacy without independent verification. Manufacturers have a vested interest in promoting their products, and while their data is valuable, independent validation by the healthcare institution is crucial for ensuring that the technology is suitable for the specific clinical environment and patient population. This oversight could lead to regulatory noncompliance if the institution fails to meet its own standards for technology assessment. Professional reasoning. Professionals facing such a situation should adopt a structured decision-making process. This begins with a clear understanding of the governance review's findings and their implications. Next, a comprehensive assessment of the proposed technology's benefits risks, and resource requirements should be conducted. This assessment must involve all relevant stakeholders, including surgeons, nurses, biomedical engineers, and hospital administrators. The process should then move to developing a robust implementation plan that includes rigorous validation, comprehensive training, and clear protocols for monitoring performance and patient outcomes. Finally, ongoing evaluation and adaptation of the implementation strategy are essential to ensure continued safety and effectiveness. This systematic, evidence-based, and collaborative approach ensures that technological advancements are integrated responsibly, prioritizing patient safety and regulatory compliance. Question 14. Which approach would be most appropriate for a surgical team encountering a critical surgical instrument that may not have undergone the full sterilization process, considering the regulatory framework for surgical technology in the United States? Option A. Proceed with the surgery using an alternative instrument while deferring the investigation of the original instrument until after the procedure is completed. Option B. Attempt to quickly re-sterilize the instrument using an unvalidated or expedited method before continuing the surgery. Option C. Assume the instrument is sterile based on its appearance and proceed with the surgery to avoid delaying patient care. Option D. Immediately halt the procedure, retrieve a sterile alternative instrument, and initiate a documented investigation into the sterilization status of the original instrument. The correct answer is D. Immediately halt the procedure, retrieve a sterile alternative instrument, and initiate a documented investigation into the sterilization status of the original instrument. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a surgical team to balance the immediate need for a critical surgical instrument with the imperative of adhering to stringent regulatory requirements for medical device reprocessing and sterilization. The pressure to proceed with surgery can lead to shortcuts that compromise patient safety and violate established protocols. Careful judgment is required to ensure that all regulatory mandates are met without unduly delaying essential patient care. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance above all else. By immediately halting the procedure and initiating a thorough investigation into the instrument's sterilization status, the team adheres to the fundamental principles of medical device safety as mandated by regulatory bodies. This proactive stance ensures that no compromised instruments are used, thereby preventing potential surgical site infections or other adverse events. This aligns with the core tenets of medical device regulations, which emphasize the importance of validated sterilization processes and the traceability of all medical equipment. Incorrect approaches analysis. One incorrect approach involves proceeding with the surgery using an alternative instrument, while deferring the investigation of the suspect instrument. This is a regulatory failure because it bypasses the established protocol for handling potentially non-sterile equipment. It creates a risk of using a non-sterile instrument if the initial assessment of the alternative instrument's sterility is flawed, or if the investigation reveals the suspect instrument was indeed sterile and the alternative is now unavailable. Another incorrect approach is to assume the instrument is sterile based on its appearance and proceed. This is a critical regulatory and ethical failure as it disregards the fundamental requirement for validated sterilization processes. Visual inspection alone is insufficient to guarantee sterility, and this assumption directly violates guidelines that mandate documented evidence of successful sterilization cycles. Finally, attempting to re-sterilize the instrument in an unvalidated or rushed manner before proceeding is also a significant regulatory failure. This circumvents the established, validated sterilization protocols, which are designed to ensure the destruction of all microorganisms. Rushed or unvalidated sterilization processes can lead to instrument contamination, posing a direct threat to patient safety and violating regulatory standards for medical device reprocessing. Professional reasoning. Professionals facing this situation should employ a systematic decision-making process rooted in risk assessment and regulatory adherence. First, immediately pause the procedure to prevent further risk. Second, consult the established institutional protocols and relevant regulatory guidelines for handling suspect or unreprocessed surgical instruments. Third, initiate a documented investigation to determine the instrument's sterilization status, involving relevant personnel such as sterile processing technicians and nursing leadership. Fourth, only proceed with the surgery once the instrument's sterility is unequivocally confirmed through validated processes and documentation, or by using a demonstrably sterile alternative. This structured approach ensures that patient safety remains paramount and that all actions are compliant with regulatory frameworks. Question 15. The review process indicates that a new robotic surgical system, boasting enhanced precision and minimally invasive capabilities, has become available. The surgical team is eager to adopt this technology to potentially improve patient outcomes and reduce recovery times. However, the system's long-term efficacy and integration into existing surgical workflows require careful consideration. Which of the following represents the most responsible and compliant approach to evaluating and potentially adopting this new surgical technology? Option A. Implement the robotic system on a trial basis for a limited number of procedures, without formal training or established protocols, and gather anecdotal feedback from the surgical team to determine its suitability. Option B. Defer the adoption of the robotic system indefinitely, citing concerns about the learning curve and potential initial disruptions, without undertaking any formal assessment of its potential benefits or risks. Option C. Prioritize a comprehensive evaluation of the robotic system's clinical evidence, safety profile, required training protocols, and potential impact on patient care pathways, ensuring alignment with institutional policies and regulatory guidelines before implementation. Option D. Immediately integrate the robotic system into surgical procedures, relying on the manufacturer's promotional materials and the team's general surgical experience to guide its use, assuming its advanced features inherently guarantee superior patient outcomes. The correct answer is C. Prioritize a comprehensive evaluation of the robotic system's clinical evidence, safety profile, required training protocols, and potential impact on patient care pathways, ensuring alignment with institutional policies and regulatory guidelines before implementation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the rapid evolution of surgical technology and the inherent responsibility of surgical teams to maintain patient safety and optimal outcomes. The challenge lies in balancing the adoption of potentially beneficial new technologies with the need for rigorous evaluation, proper training, and adherence to established protocols. Misjudgments can lead to patient harm, increased costs, and regulatory non-compliance. Correct approach analysis. The correct approach emphasizes a systematic and evidence-based evaluation of new surgical technologies. This aligns with the core principles of patient safety and quality improvement, which are paramount in surgical practice. Regulatory frameworks, such as those governing medical devices and professional conduct, mandate that healthcare providers ensure the safety and efficacy of any technology used in patient care. This involves understanding the technology's intended use, potential risks and benefits, the need for specialized training, and integration into existing workflows. Adherence to institutional policies and professional guidelines, which are often informed by regulatory requirements, is crucial for responsible adoption. Incorrect approaches analysis. One incorrect approach involves the immediate adoption of a new surgical technology based solely on its perceived novelty or marketing claims, without adequate evaluation. This bypasses essential safety checks and regulatory due diligence, potentially exposing patients to unproven risks and violating professional standards that require evidence-based practice. Another incorrect approach is to dismiss a new technology outright due to resistance to change or a lack of understanding, without a fair and objective assessment of its potential benefits. This can stifle innovation and prevent patients from accessing potentially superior treatment options, which could be seen as a failure to provide the highest standard of care. A third incorrect approach is to implement a new technology without ensuring adequate training for the surgical team. This directly compromises patient safety, as improper use can lead to complications. Regulatory bodies and professional organizations often have specific guidelines regarding the competency and training required for the use of advanced medical equipment. Professional reasoning. Professionals should employ a structured decision-making framework when considering new surgical technologies. This framework typically involves 1. Identifying the need or potential benefit. 2. Conducting a thorough literature review and seeking evidence of efficacy and safety. 3. Evaluating the technology's technical specifications, potential risks, and contraindications. 4. Assessing the need for specialized training and resources. 5. consulting with relevant stakeholders, including surgeons, nurses, biomedical engineers, and hospital administration. 6. Performing a risk-benefit analysis specific to the patient population and institutional context. 7. Developing clear protocols for implementation and ongoing monitoring. 8. Ensuring compliance with all applicable regulatory requirements and institutional policies. Question 16. The analysis reveals that a surgical team is preparing to integrate a new robotic-assisted surgical system into their practice. To ensure patient safety and optimize the use of this advanced technology, what is the most appropriate initial approach for the surgical team to adopt? Option A. Delegate the responsibility for assessing and managing any integration issues solely to the technology vendor, as they are most familiar with the equipment. Option B. Proceed with the integration, assuming that the team's extensive experience with traditional surgical methods will allow for a seamless adaptation to the new robotic system. Option C. Focus exclusively on the technical specifications and advanced features of the robotic system to ensure the surgeons are proficient in its operation. Option D. Conduct a thorough risk assessment that identifies potential challenges in team communication, workflow integration, and the learning curve associated with the new technology, and develop specific mitigation strategies. Correct answer is D. Conduct a thorough risk assessment that identifies potential challenges in team communication, workflow integration, and the learning curve associated with the new technology, and develop specific mitigation strategies. Explanation. This scenario presents a professionally challenging situation due to the inherent complexity of surgical team dynamics, particularly when introducing novel technology. The challenge lies in balancing the potential benefits of the technology with the established roles, communication patterns, and skill sets within the surgical team. Ensuring patient safety and optimal outcomes requires a proactive and systematic approach to identifying and mitigating potential risks associated with the integration of new tools and techniques. Careful judgment is required to assess how the technology might impact team cohesion, information flow, and the overall surgical process. The correct approach represents best professional practice because it prioritizes a comprehensive risk assessment that involves all relevant stakeholders. This aligns with the fundamental ethical and regulatory principles of patient safety and quality improvement, which are paramount in surgical practice. By systematically identifying potential hazards, evaluating their likelihood and impact, and developing appropriate mitigation strategies, the team can proactively address issues before they compromise patient care. This approach fosters a culture of safety and continuous improvement, encouraging open communication and shared responsibility for patient outcomes. Regulatory frameworks in surgical practice, such as those governing medical device implementation and team training, emphasize the importance of such due diligence to ensure that new technologies are introduced safely and effectively. An incorrect approach that focuses solely on the technical capabilities of the new technology without considering its impact on team dynamics would be professionally unacceptable. This overlooks the critical human factors involved in surgical procedures. Such an approach could lead to communication breakdowns, misunderstandings, and an inability for the team to effectively utilize the technology, thereby increasing the risk of adverse events. This failure to consider the broader operational context and team integration constitutes a regulatory and ethical failure to uphold the standard of care. Another incorrect approach that relies on the assumption that experienced surgeons will naturally adapt to new technology without specific training or protocol development is also professionally unsound. This neglects the fact that even experienced individuals may require structured learning and practice to master new tools and integrate them seamlessly into their workflow. The absence of targeted training and clear protocols can lead to inconsistent application of the technology, increased error rates, and a failure to fully leverage its potential benefits. This represents a failure to meet regulatory requirements for adequate training and competency assessment for medical professionals using new equipment. The professional decision-making process for similar situations should involve a structured risk management framework. This begins with identifying all potential risks, including those related to technology, team communication, workflow, and patient factors. Next, each identified risk should be analyzed to determine its likelihood and potential severity. Based on this analysis, appropriate mitigation strategies should be developed and implemented. This process should be iterative, with ongoing monitoring and evaluation to ensure the effectiveness of the mitigation strategies and to identify any new risks that may emerge. Crucially, this process must involve open communication and collaboration among all members of the surgical team, as well as relevant support staff, to ensure a holistic and effective approach to patient safety. Question 17. Market research demonstrates a growing demand for robotic-assisted surgical procedures, prompting the establishment of a new robotic surgery program. When selecting the initial suite of surgical instruments for this program, which approach best aligns with regulatory requirements and professional best practices for ensuring patient safety and instrument efficacy? Option A. Opt for instruments that are widely used in traditional open surgery, without specific consideration for their adaptation and performance in a robotic surgical environment. Option B. Select instruments based primarily on the latest technological innovations and marketing materials provided by manufacturers, assuming newer designs inherently offer superior performance. Option C. Prioritize instruments with a proven track record of reliability and efficacy in similar surgical procedures, ensuring they meet all relevant regulatory approvals for medical devices and are compatible with established sterilization protocols. Option D. Choose instruments that are most cost-effective, even if they have limited clinical data or require specialized, unproven maintenance procedures. The correct answer is C. Prioritize instruments with a proven track record of reliability and efficacy in similar surgical procedures, ensuring they meet all relevant regulatory approvals for medical devices and are compatible with established sterilization protocols. Explanation. Scenario analysis. This scenario presents a professional challenge in selecting surgical instruments for a new robotic surgery program. The challenge lies in balancing the rapid advancement of surgical technology with the need for established, reliable, and safe instrumentation. Professionals must navigate the introduction of novel instruments while ensuring they meet rigorous standards for patient safety, efficacy, and regulatory compliance. The decision-making process requires a deep understanding of instrument types, their intended use, material science, sterilization protocols, and the specific regulatory landscape governing medical devices in the relevant jurisdiction. Correct approach analysis. The correct approach emphasizes a systematic evaluation of instruments based on their established classifications and proven efficacy in similar surgical contexts. This involves prioritizing instruments with a history of successful use, robust clinical validation, and clear regulatory approval for their intended application. For example, understanding the difference between grasping, cutting, and dissecting instruments, and ensuring that any new robotic-compatible versions of these fundamental types have undergone thorough testing and meet the same performance benchmarks as their traditional counterparts. This aligns with the regulatory framework's mandate for patient safety and device efficacy, ensuring that the introduction of new technology does not compromise established standards of care. It reflects best professional practice by grounding innovation in evidence-based selection and adherence to regulatory requirements for medical devices. Incorrect approaches analysis. An approach that prioritizes novelty and perceived technological advancement without rigorous validation is professionally unacceptable. This could involve selecting instruments solely based on their cutting-edge design or marketing claims, without verifying their clinical performance, material integrity, or compatibility with existing sterilization and maintenance protocols. Such an approach risks patient harm due to instrument failure, infection, or suboptimal surgical outcomes. It represents a failure to comply with regulatory requirements that mandate evidence of safety and efficacy for all medical devices. Another incorrect approach would be to solely rely on the recommendations of instrument manufacturers without independent verification or consultation with experienced surgical teams. While manufacturers provide valuable information, their primary objective is sales. Professional judgment requires an independent assessment of the instrument's suitability, considering factors beyond the manufacturer's claims, such as long-term durability, ease of use in the specific surgical environment, and cost-effectiveness in relation to patient benefit. This approach neglects the professional responsibility to critically evaluate all information and make decisions based on comprehensive evidence and patient welfare, potentially violating ethical guidelines and regulatory oversight. A further incorrect approach would be to overlook the importance of instrument sterilization and maintenance compatibility. Selecting instruments that are difficult to clean, prone to damage during sterilization, or require specialized, unproven maintenance procedures, introduces significant risks of infection and instrument malfunction. This directly contravenes regulatory requirements for infection control and device integrity, jeopardizing patient safety and the operational efficiency of the surgical program. Professional reasoning. Professionals should adopt a decision-making process that begins with a thorough understanding of the surgical procedures to be performed and the specific needs of the robotic surgery program. This should be followed by a comprehensive review of available instrument types, categorizing them by function, e.g., grasping, cutting, dissecting, retracting. For each category, professionals must evaluate instruments based on evidence of clinical efficacy, material quality, durability, sterilization compatibility, and regulatory approval within the specified jurisdiction. Consultation with experienced surgeons, biomedical engineers, and infection control specialists is crucial. A risk assessment should be conducted for any novel instruments, comparing them against established benchmarks, and ensuring that any new technology offers a demonstrable improvement in patient outcomes or surgical efficiency without compromising safety. Adherence to the regulatory framework for medical devices, including pre-market approval processes and post-market surveillance, must be a guiding principle throughout the selection and implementation process. Question 18. Governance review demonstrates that a new AI-powered robotic system for complex orthopedic joint replacements has shown promising preliminary results in a limited trial. The hospital is considering a rapid, broad implementation to enhance surgical precision and potentially reduce recovery times. Which of the following approaches best aligns with the principles of responsible technological adoption in orthopedic surgery, considering patient safety and regulatory compliance? Option A. Conduct a comprehensive impact assessment evaluating the technology's clinical efficacy, patient safety profile, required surgical team training, data security implications, and integration with existing hospital systems before full-scale deployment. Option B. Prioritize immediate widespread adoption of the AI-powered robotic system across all orthopedic departments to capitalize on its perceived benefits and gain a competitive advantage, deferring detailed impact assessments to a later stage. Option C. Implement the AI-powered robotic system only in select cases where the surgeon has prior personal experience with similar robotic technologies, without formal institutional training or system-wide impact analysis. Option D. Focus primarily on the cost-effectiveness of the AI-powered robotic system, negotiating favorable purchasing agreements and rolling it out broadly as a cost-saving measure, with minimal emphasis on clinical validation or team training. The correct answer is A. Conduct a comprehensive impact assessment evaluating the technology's clinical efficacy, patient safety profile, required surgical team training, data security implications, and integration with existing hospital systems before full-scale deployment. Explanation. This scenario presents a professional challenge due to the inherent risks associated with advanced surgical technologies in orthopedic procedures and the imperative to ensure patient safety and regulatory compliance. The rapid evolution of surgical robotics and AI-driven diagnostic tools necessitates a rigorous impact assessment before widespread adoption. Careful judgment is required to balance the potential benefits of innovation with the need for robust validation, training, and ethical oversight. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based evaluation of the technology's impact on patient outcomes, surgical team competency, and data security. This aligns with the core principles of patient welfare and professional responsibility, as well as the implicit requirements of regulatory frameworks that mandate due diligence in adopting new medical technologies. Specifically, it addresses the need for understanding potential risks, ensuring adequate training, and establishing clear protocols for data handling and system maintenance, all of which are critical for responsible innovation in healthcare. An incorrect approach that focuses solely on cost reduction without a thorough assessment of clinical efficacy or patient safety would represent a significant regulatory and ethical failure. It would violate the principle of do no harm by potentially exposing patients to unproven or inadequately validated technologies. Another incorrect approach that bypasses essential training for surgical teams would similarly be a failure, as it compromises the ability of clinicians to safely and effectively operate the technology, leading to increased risk of adverse events and potential breaches of professional standards. Furthermore, an approach that neglects data privacy and security protocols would be a direct contravention of data protection regulations and ethical obligations to safeguard patient information. Professionals should employ a decision-making framework that begins with identifying the specific clinical need the technology aims to address. This should be followed by a thorough literature review and evidence assessment of the technology's efficacy and safety. A comprehensive risk-benefit analysis, including potential complications and mitigation strategies, is crucial. Subsequently, the impact on existing workflows, the necessity for specialized training, and the integration with existing IT infrastructure and data security protocols must be evaluated. Finally, a phased implementation plan with clear performance metrics and ongoing monitoring should be established, ensuring alignment with all relevant regulatory guidelines and ethical considerations. Question 19. During the evaluation of a new robotic surgical system proposed for advanced laparoscopic hysterectomies, which approach best aligns with ensuring patient safety and regulatory compliance within the framework of surgical technology certification? Option A. Prioritizing a comprehensive review of peer-reviewed clinical trials demonstrating improved patient outcomes, a robust risk assessment of the system's components and software, and confirmation of manufacturer compliance with relevant medical device regulations, alongside a structured training program for surgical staff. Option B. Adopting the technology immediately based on its innovative features and the manufacturer's claims of enhanced precision, assuming its advanced nature inherently guarantees superior patient results. Option C. Proceeding with the adoption of the technology without extensive validation, focusing on the potential cost savings and the prestige associated with utilizing cutting-edge equipment. Option D. Implementing the robotic system after a brief demonstration by the manufacturer, relying primarily on the surgeon's prior experience with similar, albeit different, robotic platforms. Correct answer is A. Prioritizing a comprehensive review of peer-reviewed clinical trials demonstrating improved patient outcomes, a robust risk assessment of the system's components and software, and confirmation of manufacturer compliance with relevant medical device regulations, alongside a structured training program for surgical staff. Explanation. This scenario is professionally challenging due to the rapid evolution of surgical technology and the need to ensure patient safety and efficacy in obstetric and gynecological procedures. The introduction of new robotic systems requires a rigorous evaluation process that balances innovation with established clinical standards and regulatory oversight. The core of the challenge lies in discerning between genuine technological advancement that improves patient outcomes and unproven methods that may introduce undue risk. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation aligned with regulatory frameworks designed to protect patients. This involves a thorough review of the technology's design, validation studies, and potential impact on surgical workflows and patient recovery. Adherence to guidelines from relevant professional bodies and regulatory agencies ensures that any new technology is implemented only after demonstrating safety, efficacy, and a clear benefit over existing methods. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that patient care is advanced responsibly. An incorrect approach that focuses solely on the novelty or perceived efficiency of a new robotic system without rigorous validation would be a significant regulatory and ethical failure. This bypasses the essential steps of ensuring the technology is safe and effective, potentially exposing patients to unknown risks. Another incorrect approach, such as adopting the technology based on anecdotal evidence or marketing claims alone, disregards the need for robust clinical data and peer review, violating the principle of evidence-based medicine. Furthermore, failing to ensure adequate training and competency for surgical teams using the new technology constitutes a failure to uphold standards of care and patient safety, which are paramount under any regulatory framework governing medical devices and surgical practice. Professionals should employ a decision-making process that begins with identifying the clinical need or problem the new technology aims to address. This is followed by a comprehensive literature review and assessment of available evidence regarding the technology's performance, safety profile, and cost-effectiveness. Consultation with multidisciplinary teams, including surgeons, nurses, biomedical engineers, and hospital administrators is crucial. The process must also include a clear understanding of the relevant regulatory requirements for medical device approval and implementation, ensuring all necessary documentation and approvals are obtained. Finally, a pilot program with robust data collection and post-implementation monitoring is essential to confirm real-world performance and patient outcomes before widespread adoption. Question 20. The efficiency study reveals that a newly developed robotic surgical system significantly reduces operative times and associated costs for a specific procedure. However, the study does not include comprehensive data on potential long-term patient outcomes or rare adverse event profiles. As the lead surgeon responsible for patient care and the adoption of new technologies, what is the most ethically and regulatorily sound approach to integrating this system into your surgical practice? Option A. Immediately implement the robotic system across all relevant procedures to capitalize on the demonstrated efficiency gains and cost savings. Option B. Reject the robotic system outright due to the lack of comprehensive long-term patient outcome data, prioritizing established surgical methods. Option C. Proceed with the adoption of the robotic system, relying primarily on the manufacturer's assurances and the initial efficiency study's findings. Option D. Advocate for a pilot program to independently validate the system's impact on patient safety and long-term outcomes, establishing clear monitoring protocols for adverse events before considering broader adoption. The correct answer is D. Advocate for a pilot program to independently validate the system's impact on patient safety and long-term outcomes, establishing clear monitoring protocols for adverse events before considering broader adoption. Explanation. Scenario analysis. This scenario presents a professional challenge where a new technological advancement, while promising efficiency gains, introduces potential risks to patient safety. The core conflict lies in balancing the drive for operational improvement with the paramount ethical and regulatory obligation to protect patients. The surgeon must critically evaluate the technology's impact on patient well-being, not just its speed or cost-effectiveness, requiring a nuanced judgment that prioritizes safety above all else. Correct approach analysis. The correct approach prioritizes patient safety by advocating for a thorough, independent validation of the technology's impact on patient outcomes and potential adverse events before widespread adoption. This aligns with the fundamental principles of medical ethics, such as non-maleficence, do no harm, and beneficence, act in the patient's best interest. Regulatory frameworks, such as those governing medical devices and surgical practice, implicitly or explicitly require that new technologies be proven safe and effective. This approach demonstrates responsible stewardship of patient care by ensuring that efficiency gains do not come at the expense of patient well-being, and it upholds the surgeon's role as a patient advocate. Incorrect approaches analysis. One incorrect approach is to immediately implement the technology based solely on the efficiency study's findings. This fails to meet the regulatory requirement for demonstrating safety and efficacy. It prioritizes efficiency over patient well-being, violating the principle of non-maleficence. Ethically, it is a dereliction of duty to expose patients to unproven risks for the sake of operational speed. Another incorrect approach is to dismiss the technology entirely without further investigation, simply due to the novelty of its integration into surgical workflows. A caution is warranted. Outright rejection without a fair assessment of its potential benefits and risks, especially in light of the efficiency study, could be seen as a failure to explore advancements that might ultimately improve patient care. This could be interpreted as a lack of commitment to staying abreast of beneficial technological progress, potentially hindering optimal patient outcomes in the long run. A third incorrect approach is to rely solely on the manufacturer's claims and the initial efficiency study without independent verification. Manufacturers have a vested interest in promoting their products, and efficiency studies, while valuable, may not comprehensively address all aspects of patient safety or long-term outcomes. This approach risks overlooking potential unforeseen complications or limitations of the technology, thereby failing to adequately protect patients and potentially contravening regulatory oversight that demands robust evidence of safety. Professional reasoning. Professionals facing such a dilemma should employ a systematic decision-making process. First, they must identify the core ethical and regulatory obligations, with patient safety being the absolute priority. Second, they should gather comprehensive information, including independent research, peer-reviewed literature, and expert opinions, beyond the initial study. Third, they should engage in a risk-benefit analysis, meticulously weighing potential advantages against potential harms to patients. Fourth, they should consider a phased implementation or pilot study with rigorous monitoring if initial assessments are promising but not conclusive. Finally, they should maintain open communication with patients about the use of new technologies and their potential implications.